Imagine waking up one day only to find out that your memories are fading, and you don't even have the strength to do anything due to severe fatigue. You feel like a shadow of yourself, and no matter how much rest you get, the exhaustion won't go away. What if I told you this isn't just a rough patch, but your body desperately warning you of something far more dangerous? Folate deficiency, a silent and often overlooked threat, can lead to these very symptoms, slowly chipping away at your health without you even realizing it. Left unchecked, it can cause chronic anemia, cognitive decline, and even increase your risk of heart disease. But the consequences don't stop with you. For pregnant women, the stakes are even more terrifying. A lack of folate during pregnancy could be silently harming your baby, leading to severe developmental disorders, or causing developmental delays that could affect your child for life. Ignoring the signs of folate deficiency could mean putting both your health and your baby's future in jeopardy. I am V, and in this video, we're diving deep into the alarming effects of folate deficiency, helping you spot the subtle signs before it's too late. Your health and your baby's future depends on it. Make sure to like this video, subscribe to the channel, and please share this video with your family and friends. Understanding folate and its importance. Before we go over the signs, let's first of all understand what folate does in our body and its benefits. Folate, also known as vitamin B9, is an essential nutrient that plays a critical role in many bodily functions, including DNA synthesis and repair, cell division, and the production of red blood cells. It's especially important for women during pregnancy as it supports the rapid growth and development of the fetus. Without adequate folate, your body can't produce enough healthy red blood cells, leading to a condition known as folate deficiency anemia. This deficiency can leave you feeling weak, tired, and vulnerable to a range of health issues that could seriously impact your quality of life. The importance of folate cannot be overstated, especially when you consider its role in preventing neural tube defects in newborns. These defects, such as spina bifida and anencephaly, occur very early in pregnancy, often before a woman even knows she is pregnant. This is why maintaining sufficient folate levels before and during pregnancy is absolutely crucial. It's not just about your health, it's about ensuring that your baby has the best possible start in life. Folate is naturally found in a variety of foods, making it relatively easy to include in a balanced diet. Leafy green vegetables like spinach and kale, legumes such as beans and lentils, and fortified foods like cereals and bread are all excellent sources of folate. However, despite the availability of folate-rich foods, many people still fall short of their daily requirements, either due to poor dietary choices or conditions that affect nutrient absorption. For women of childbearing age, the stakes are even higher, which is why folate supplementation is often recommended during pregnancy to ensure both the mother and the baby are protected. Understanding folate and its vital role in your health is the first step in preventing the potentially devastating effects of deficiency. Next, we'll explore the specific signs and symptoms of folate deficiency in both adults and newborns, so you can recognize the warning signs early and take action to protect yourself and your family. Signs and effects of folate deficiency in adults. Folate deficiency in adults often begins subtly, with symptoms that can easily be mistaken for general tiredness or stress. However, these early signs are your body's way of signaling that something is seriously wrong. One of the most common symptoms is persistent fatigue. No matter how much sleep you get, you still feel exhausted. This isn't just regular tiredness, it's a deep, bone-weary fatigue that makes even the simplest tasks feel overwhelming. Along with fatigue, you might notice a growing sense of weakness or muscle aches that weren't there before, making daily activities increasingly difficult. As the deficiency progresses, more alarming symptoms can start to appear. You might experience mouth sores, a swollen tongue, or a pale complexion, all signs of your body struggling to produce enough healthy red blood cells. Shortness of breath and dizziness can also occur, especially during physical activity, as your oxygen levels drop due to the lack of red blood cells. Mentally, you may find it harder to concentrate or remember things, and this cognitive decline can become quite severe if the deficiency is left untreated. Depression, irritability, and confusion are also common, as folate is crucial for the production of neurotransmitters that regulate mood and cognitive function. The long-term effects of folate deficiency can be devastating if not addressed. Chronic anemia, which results from prolonged folate deficiency, can lead to heart complications and increase your risk of cardiovascular disease. Additionally, neurological problems such as peripheral neuropathy, a condition where nerves in the extremities become damaged, can develop, causing pain, tingling, or numbness in the hands and feet. For women of childbearing age, a folate deficiency can also lead to complications during pregnancy, increasing the risk of miscarriage, premature birth, and serious birth defects in the baby. Recognizing these signs early is critical for preventing long-term damage. If you're experiencing any of these symptoms, it's essential to consult with a healthcare provider who can assess your folate levels and recommend appropriate treatment. Whether through dietary changes, supplementation, or both, addressing folate deficiency can restore your energy, protect your heart, and safeguard your cognitive function before the damage becomes irreversible. Next, we'll shift our focus to the effects of folate deficiency in newborns and the crucial role it plays during pregnancy. And if you are liking this video so far, please give it a like, subscribe if you have not subscribed yet. Signs and effects of folate deficiency in newborns. Folate deficiency during pregnancy poses significant risks not only to the mother but also to the developing baby. One of the most critical periods for folate intake is during the early stages of pregnancy when the neural tube, which later forms the brain and spinal cord, develops. If a pregnant woman doesn't get enough folate, it can lead to severe birth defects such as spina bifida and anencephaly. These conditions occur when the neural tube fails to close properly, leading to potentially life-threatening and lifelong disabilities for the child. The impact of folate deficiency doesn't end at birth. Babies born to mothers with low folate levels can suffer from various health issues. Low birth weight is a common consequence, which can lead to a range of complications, including difficulty in feeding, increased susceptibility to infections, and delayed physical and mental development. Developmental delays are particularly concerning, as they can affect a child's ability to reach important milestones, such as sitting up, crawling, walking, and talking. In more severe cases, folate deficiency in newborns can result in poor brain development, leading to cognitive impairments that might affect the child throughout their life. This can manifest as learning difficulties, behavioral issues, and other challenges that may require ongoing support and intervention. The importance of folate in supporting proper brain and nervous system development cannot be overstated. Without adequate levels, the risk of these developmental problems increases significantly. For pregnant women, ensuring sufficient folate intake is essential not only for their health, but also for the healthy development of their baby. The good news is that these risks are largely preventable. By recognizing the importance of folate early in pregnancy and taking steps to maintain adequate levels, many of these complications can be avoided. This is why healthcare providers often recommend folic acid supplements in addition to a folate-rich diet during pregnancy to ensure both mother and baby are protected. As we've seen, the effects of folate deficiency in newborns can be severe and far-reaching. But with proper awareness and proactive care, these risks can be minimized. Next, we'll discuss practical steps you can take to prevent folate deficiency, ensuring both you and your baby stay healthy. Preventing folate deficiency. Preventing folate deficiency is crucial for maintaining good health, particularly during pregnancy. The first and most straightforward approach to prevention is ensuring a diet rich in folate. Fortunately, folate is found in many common foods, making it accessible to most people. Leafy green vegetables like spinach, kale, and broccoli are some of the best sources, along with legumes such as beans, lentils, and peas. Including these foods in your daily diet can significantly boost your folate levels and help prevent deficiency. In addition to leafy greens and legumes, other foods such as citrus fruits, nuts, seeds, and fortified cereals are excellent sources of folate. Many countries also fortify staple foods like bread, pasta, and rice with folic acid, the synthetic form of folate, to help prevent deficiencies in the general population. It's important to note that cooking can reduce the folate content in food, so consuming raw or lightly cooked vegetables can help preserve their nutritional value. For women who are pregnant or planning to become pregnant, folic acid supplements are often recommended. This is because the demand for folate increases significantly during pregnancy, and it can be challenging to meet this increased need through diet alone. The standard recommendation is to take a folic acid supplement containing 400 to 800 micrograms daily, starting at least 1 month before conception and continuing through the first trimester. This helps ensure that the developing baby receives adequate folate, reducing the risk of neural tube defects and other complications. Beyond diet and supplements, it's also essential to be aware of any conditions or lifestyle factors that might increase your risk of folate deficiency. For example, certain medical conditions like celiac disease, inflammatory bowel disease, and some forms of anemia can interfere with the body's ability to absorb folate. Additionally, alcohol consumption and certain medications can deplete folate levels. If you have any of these risk factors, it's important to discuss them with your healthcare provider, who may recommend more frequent monitoring of your folate levels or additional supplementation. Early detection is key to preventing the serious consequences of folate deficiency. If you notice symptoms like persistent fatigue, mouth sores, or cognitive difficulties, it's important to seek medical advice. A simple blood test can determine your folate levels, and if they're low, your healthcare provider can help you develop a plan to restore them through diet, supplements, or other treatments. By taking these proactive steps, you can protect yourself from the harmful effects of folate deficiency. For pregnant women, this means safeguarding your baby's development and ensuring they have the best possible start in life. As we've explored throughout this video, folate deficiency is a silent but serious threat that can have far-reaching consequences for both adults and newborns. The symptoms may start subtly: fatigue, weakness, and cognitive fog that could easily be dismissed as everyday stress. But these are early warning signs of a deeper problem that, if left untreated, can lead to chronic anemia, neurological damage, and an increased risk of cardiovascular disease. For pregnant women, the stakes are even higher, as insufficient folate can result in devastating outcomes for the baby, including neural tube defects, low birth weight, and developmental delays. The good news is that folate deficiency is largely preventable. By incorporating folate-rich foods into your diet and, when necessary, taking folic acid supplements, you can protect yourself and your baby from the harmful effects of deficiency. For those with additional risk factors, like certain medical conditions or lifestyle choices, it's essential to stay informed and work closely with your healthcare provider to ensure your folate levels are adequate. Remember, early detection is key. If you're experiencing symptoms that could indicate a folate deficiency, don't ignore them. Take action by consulting a healthcare professional and getting the necessary tests. It's a simple step that can make a significant difference in your health and well-being. In summary, maintaining sufficient folate levels is vital for everyone, but especially for women who are pregnant or planning to become pregnant. By being vigilant about your folate intake, you're not just taking care of your own health, you're also ensuring that your baby has the best possible start in life. Thank you for watching, and if you found this video helpful, please like, share, and subscribe for more health-related content. Stay informed, stay healthy, and take control of your well-being. And don't forget to join me in the next video, where we'll dive into another critical health topic that you won't want to miss. Your health journey is just beginning. Let's take the next step together.